So Salim from Brooklyn, New York. Today I want to show you three quick techniques to help the asthma symptoms or breathing symptoms. But I'm going to show only three. But the actual techniques is much more like 20. Just today we're going to be three. If you want to get your patient much better, you have to do all the techniques. But I'm going to show today three. One of them going to help an asthma patient is called to relax the smooth muscles of the superficial veins of the trunk. And how to do it is very simple. I'm going to take, okay, this here. First of all, if you want to examine your patient, see, could be the technique is indicated or no. We spoke about that before. Okay, if you go in a xiphoid, xyphosternum, go one finger breath lateral and a breath here extender, means this technique might be indicated. So we're going to take, no, relax my brother. This technique or advanced counter strain technique, all the counter strain techniques, both the Lawrence Jones and the Dry Mateo, the advanced ones, all has to be fully passive. 100% passive means the patient relax, and the clinician or practitioner will be only the one who's working. Can you climb up a little bit, my brother? Please climb up tiny bit. Thank you. Fully relax, please. Now, fully. Now relax, my brother. Just fully relax, please. I'm gonna take this neck now. My brother has difficulty to relax. I'm gonna take the neck for 50-degree neck flexion. Okay, and I'm gonna 20 degrees rotation to the side I'm treating. But my brother is not fully relaxed. This affects the technique, of course. So you need to do positional facilitated release if you have a patient who cannot relax. Then press on that tender point we spoke out before. By 5 grams of force, you're gonna push posterior, okay, posterior, inferior, and lateral. And you push and keep this between 1 minute and 5 minutes if you can. If you want to do the other side, you're going to turn the head to rotation to the other side and do the other side as well. Okay, going to do the other side. So I'm going to rotate here, just for the sake of showing the technique. 30 seconds could be helping as well if you do the treatment very often with your patients. Okay, this for the other side. Now I'm going to show you how to relax the smooth muscles of the inferior alveolar and Balmonder veins. You're going to go in the posterior rib angle. You know the ribs have angle like this and a posterior aspect. Patient has to be supine. This try me two technique. Patient has to be supine, cannot be from broom. The rib has angle like here in the posterior angle. If you do have 12 reps, so check in the posterior angle of each rep and you press in that angle. If the rib angle, posterior rib angle is tender, it means this technique might be indicated. And how you to do that? Just relax, my brother, fully relax. You're gonna put, I use 4 fingers of each hand. I need to move my finger like this to adjust for 4 ribs each. Rib angle, I'm gonna push this rib angle anteriorly, medial. Anteriorly and medial with 5 grams of force. And you do this for the 12 reps. If you can use 6 reps at a time, you can use the 3 fingers from each hand, index, middle, ring finger of both hands. You do this for 6 reps at a time. Then you move up for the other reps. Again, you push the posterior rib angle anteriorly and medially as well. When you do this, you compress the medial part of the rib medially. You compress the costovertebral joint medially. You press the rib angle medially. This helps patient breathe better and feel much better after that. Then you're going to go up again and do most of the chronic asthmatic or emphysema patient, they have tenderness over there. They have, tenderness and pain, and the tenderness and pain gets much better with this. You push the rib angle, as I said, medially, anteriorly with 5 grams of force. You keep this between 1 minute and 5 minutes. It depends how chronic and how often you do the treatment with your patients. And you repeat for the other side. This for the inferior alveolar and pulmonary veins. For the superior alveolar and pulmonary veins, you're going to do, instead of pressing on the rib angle, you're going to go medial to the rib angle. If this is a spine here, this is a spine, and this is a rib angle, you're going to go medial. Medial rib angle, if it's tender, meaning indicated, you're going to take the rib angle lateral. You're going to push rib angle anteriorly and laterally. But while you're compressing the whole lung a little bit, you're going to go here now. If you do the side, I'm going to put my 4 fingers medial to the rib angle. I check if it's tender, mean is needed. I'm gonna press here on a whole lung with my hand like this, with 5 grams of force, 5 to 10 grams maximum. And the other one, the same one. I'm gonna take it lateral and anterior, 5 grams of force. This will help distract the costovertebral joint a little bit. We compress the costovertebral joint before. Now we're distracting the costovertebral joints. And at the same time, medial ribs is being moved laterally. You compress the lung, the whole lung, like that. And you can move your hand to the other 4 ribs while keep compressing the lung at the same time. I'm gonna pull lateral and compress. Now I'm doing like 3 reps at a time. So you do 4 times to finish the 12 reps. And you can do the same side, other side as well. For here, it's very stiff. Most likely this is the one affected. For my brother, the up, like the ribs from the 3 to 8 is very affected, very stiff. So I'm gonna press here a little bit, and I'm gonna. Does it hurt you, brother, a little bit?
No, I feel that, but it's not too bad.
Does not. It's better, yeah. But this technique I'm doing for you is helping your breathing.
Oh yeah. Okay.
You recommend it to the people.
Okay.
Yes. You recommend it?
Yeah, sure.
Yes. Okay. So now, guys, I showed you the 3 techniques. Okay. Please do it with your patients. This for young doctors or doctors only. Do it with your patients. Write your comments down. If you have any comments, write it down. See how it works. If somebody want to do RCT or randomized controlled trial or do researches, please do researches, guys, and find out how it's helping. Okay. If the first time to see me now, please subscribe, press like, share it with your friends, and bye now.